Well, Oak Park Dental can really make you smile. Not only do they practice general dentistry, but they have specialty practices on site too that can tackle any of your issues without having to go somewhere else. We've got Dr. Castle and Mike Ellender here to tell us how you guys can really help even the most nervous patient relax.
Oh, we really can. You know, anxiety and apprehension are the two things that keep people from coming to see us and having a really good dental work done. So by doing away with those things and learning to sedate people, makes them relax. They have no apprehension, no anxiety, those are gone. And it makes people have dental work done much more readily. And we have Mike here with us today, and he's an anesthetist that works at Oak Park Dental. And he handles all of our sedation for us.
So that probably makes it a lot easier on you to work on a patient while he oversees the anesthesia.
Much easier. Much easier, it really does.
What levels of anesthesia are you providing?
We can do anything from light sedation all the way up to general anesthesia, so it's really dependent on the patient's wants or needs, the type of procedure, and their medical history. At Oak Park Dental, we always do a thorough medical history on everybody to make sure they're good candidates and it's safe for the patient.
All right. And it's really amazing that something that seems as simple as going to the dentist can give you so much anxiety. We get so nervous about that. Why do you think that is?
You know, we've dealt with this forever. People have a really high anxiety level when they talk about coming to the dentist, and when people generally just don't like you fooling in their mouths, and they're afraid of pain in their mouth, and they really have a lot of apprehensions. We try to do away with all of those and flatten that out. And then people can come in and get all the work done, and it makes people go get a lot more dental work done than would normally get done. Because 30% of the people don't get dental work done because of anxiety and fear.
They're worried about having any type of pain in a very sensitive area in their mouths.
That's exactly right.
And usually the patients don't remember anything either after the sedation, so
it knocks out any of that anxiety as well.
It knocks out the anxiety, it knocks out the memory. Usually they have some amnesia, so it's good all the way around.
I'm a big fan. I like going to the dentist. I like having my regular cleanings. I like to floss at home, and I find just doing that can kind of help alleviate some of that anxiety. Is that something that you find true with other patients as well?
Correct, yeah. But the 6 month cleanings and things don't have a lot of anxiety. But when you start talking about doing a lot of different procedures on people that are more complicated, their anxiety, you can watch them, it just goes straight up after that. They get fearful and they get scared to do it and everything. So you have to give them an avenue or a path to follow that'll take all that away. They can come in, they won't feel anything, and then, like you said, they won't remember anything.
And then when all is said and done, they've got a healthier smile, they've got a more beautiful smile, and that kind of makes it all worthwhile.
That's right.
All right, so you really talk to your patients about not only with their medical history, but what their own personal anxiety level is to try and get the best fit for them.
Yes, ma'am. We tailor each anesthetic to meet the patient's needs, so not everything's it's not done the same way every time. It's not a cookie cutter recipe, so we can give them as much or as little as they need to alleviate that anxiety and get the procedure done for them.
All right. Do you recommend people give you a call, come in and talk to you before making the jump to having any procedures done?
Well, we do. We just start recommending it to people right away when they come in. And a lot of people aren't aware that we really can sedate people right in the office. And they're really happy when they hear that we do that. And it just makes it a lot more wonderful visit. It makes for a better day at the park.
I bet it does for a lot of people out there. 30% is a large margin of people avoiding. So don't avoid going to the dentist when they can make you smile and make you feel good about it. Thank you so much, guys.
Thank you.
All right. Stay with us.